COVID-19 updates now. Cases of the coronavirus in Nigeria have now passed the 20,000 mark. The Nigeria Center for Disease Control reported 436 new cases of COVID-19 from 19 states overnight, taking the country's total number of cases to 20,244. Lagos recorded the highest figure with 169, followed by Oyo 52, Plateau 31, Imo 29, Kaduna 28, Ogun 23. Federal Capital Territory and Enugu recorded 18 new cases, while Bauchi had 17 new cases. Bayelsa recorded 14 new cases, Rivers 8, Osun and Kano 6 cases each. Edo and Benue also recorded 5 new cases each, Adamawa 3, Borno 2, Abia and Ekiti 1 new case each. A total of 6,879 persons have been discharged, while 518 persons have died from COVID-19 related complications. Joining me via Skype from Kano to talk about the transmission by asymptomatic patients is Dr. Usman Bashir, a public health physician. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, the numbers keep rising every morning. Nigerians wake up to the number of infections rise, and there are concerns that a person with asymptomatic symptoms might be spreading the virus from what is happening now. How concerning is this for you, and could that be the case?
Yes, that is very concerning. When you look at the trends, now, as we know, we are now in the community transmission phase of the infection. And when you look at the data from April to now, in April we had around 500 and something cases. In May, the number quadrupled or almost to 5,000 something. Now we have about 20,000 people infected, meaning that and we know that 80% of those that have the disease don't show symptoms, and they are the major vehicles of transmission. So, and then if those measures are not fully implemented, that is the wearing of face masks in public places, as we have been seeing now, people are not complying with, even though the lockdown is being relaxed, and then the numbers are rising. That should send a warning signal to all of us that we really need to put on our face masks when we're in public places, and we shouldn't come out unless we need to come out. And then we need to observe the social distancing. That is not also being observed by Nigerians.
All right. And that's let's break it down a bit for a majority of our viewers to perhaps better understand. When we say asymptomatic, help us better understand what we mean by this.
It means patients that do not show any, is a carrier of the disease, and that is why even we are having problems in the isolation centers, whereby people come to the isolation center, they're tested positive, but they don't have any symptoms. So they feel they don't have any problem. And then in the long run, they are the ones transmitting the disease because their body's immunity is fighting the disease, and then they are immunocompetent. They are not like the vulnerable group like people who have diabetes or hypertension or the elderly or people who have other background illnesses that might impair their immunity and cause them to be at risk of developing either mild or severe symptoms and even death. As we are seeing now, we have more than 500 deaths in Nigeria, which is really alarming and is something that we need to take seriously.
So how much of a challenge does this pose to government effort to flatten the curve?
Like I said, fighting coronavirus is not only the government effort. Government can put all the measures, but as the people, if we don't put our personal commitment, we don't do what is right, we don't observe all the protocols, we violate all the rules and regulations set by the government, it's going to be an uphill task for all of us. And these numbers should scare all of us, should tell us this is something serious, and we don't want the repeat of what happened in the Spanish flu, or we don't want to have a second wave, which is also on the offing. So we need to really be very careful and see what is happening in other countries that ease their lockdown. After easing their lockdown, the numbers kept rising. They had to close down. So please, let's try as much as possible that the lockdown is being eased. People should observe the protocol so that we won't go back to the lockdown, because as we know, the economy is suffering, and we don't want our economy to be suffering and have other problems that come down with bad economics activities. So we really need to observe those protocols, and we need to do all our efforts with the government, because the government cannot do it alone, as I've said earlier. We need to show our commitment. People need to observe the protocols.
So as it stands, there are projections that perhaps from now until 2022, it is important that Nigerians as well as people across the world have to observe physical distancing. Is that what it is, looking at how the cases are rising?
Yes, it can. That is what it is, and we don't even know that. That is just a speculation. It can be even later than that. So it depends on how we take things, how we observe the protocols. Like I said, it is a personal commitment. Me, you, and I, and all of us. Let's come together and fight this enemy. It's a war we need to fight. It's a war with an enemy that you cannot see, and he's using you to fight your people. So we need to understand this, and we need to take this into into cognizance.
Dr. Usman Bashir, thank you for speaking with us.